Welcome back. In this lecture, we will review the basic features which distinguish one group of teeth from another. Did you know that there are 4 different types of teeth in the human dentition? We will describe the maxillary teeth and compare them with the mandibular teeth and demonstrate how they work together to begin the process of digestion. Finally, we will locate and describe the structures associated with your TMJ. So let's get started. This soft tissue here is called the gingiva. Now there's a new term for you. Your gingiva is the mucous membrane surrounding your teeth. Gingiva is referred to in the lay vernacular as your gums. Now the gingiva between your teeth is known as free gingiva. Your dental floss is used to clean the space between your free gingiva and your teeth, while the gingiva firmly attached to your alveolar process is called the attached gingiva. Now healthy gingiva is kind of a bubblegum pink in color. The condition referred to as gingivitis, that means inflammation of the gingiva, is easily recognized by reddening, puffiness, and even bleeding of the mucous membrane around the teeth. So back to basics. This part of the tooth is called the crown. Now the crown is that section of the tooth above the gingiva. It's the part of the teeth that I see when you smile. The root, then, is that part of the tooth below the gingiva and which is encased in bone. That bone is called, as you now know, the alveolar process. Now there are 4 categories of teeth in the human dentition. Dentition, that's just a collection of teeth. I will describe each type of tooth and discuss its purpose shortly, but suffice it to say for now that in this mouth full of teeth there are only 4 different tooth types, and they are the incisors, the cuspids, the bicuspids, and the molars. Now your incisors are those teeth at the center of your dental arches. Another word for arches is arcades. Incisors have a knife-like cutting edge and a single root, and as their name implies, their function is to incise or cut food. So to keep you oriented, here is your midline. Now these incisors, then, which are closest to the midline and hence at the center of the arcade, are called central incisors. Now remember your symmetry. So you have 2 central incisors, one on each side of the midline. These somewhat smaller incisors just off to the sides of your central incisors are called your lateral, meaning on the side or pertaining to the side, your lateral incisors. You also have 2 lateral incisors. The cuspids are the longest and strongest teeth in your mouth. Okay, maybe yours are not this long. Cuspids are cone-shaped. Cuspids have a single, very long root, and they are called cuspids in reference to their single point or cusp on the occluding or chewing surface of the tooth. Now cuspids function in gripping and tearing. Now your cuspids are located at the corners of your mouth. So here is the midline, here is the central incisor, here is the lateral incisor, and here is the cuspid. So there are 2 cuspids per dental arch, and there are 4 cuspids in the adult dentition. Now cuspids are sometimes referred to as canines, as they are analogous to the very prominent teeth with similar function that you see on this growling dog. Bicuspids are so named because they have 2 cusps. So now you know what a cusp is, a point on the occluding surface of a tooth. So we see the cusps here and here. Now bicuspids may have 1 or 2 roots. The number of roots depends on whether it's a first bicuspid or a second bicuspid. Bicuspids function tearing and chewing. They are kind of a transition tooth, if you will, between the cuspids, designed for tearing, and the molars, designed for chewing, and which we will discuss next. Now there are 2 bicuspids per quadrant, or 4 per dental arch. You see them here. We differentiate them by numbering them 1 and 2, and so we call them first and second. So here's your midline. Working our way back from front teeth to back teeth in the arcade, we have the central incisor, lateral incisor, cuspid, and the first bicuspid here, and your second bicuspid here. The bicuspids are also referred to as premolars because they come before the molars in the arcade. You see the molars here. So here's another look at these teeth. Here's your cuspid, here's your first bicuspid with its cusps here and here, and your second bicuspid with cusps here and here. Our 4th and final tooth type is the molar. Now molars are large teeth with at least 3 and up to 5 cusps. Molars may have 2 or more roots depending on whether they are maxillary molars, which usually have 3 roots, or mandibular molars, which usually have 2. Molars are located in the back of the mouth. They have broad occluding surfaces, and they function in chewing and grinding of your food. Now, in general, there are 3 molars per arcade. Like the bicuspids, we differentiate the molars by numbering them 1, 2, or 3, and we identify them as first molar, second molar, and third molar. So looking at the arcade here, once again we have the midline, central incisor, lateral incisor, cuspid, first bicuspid, second bicuspid, and first molar, second molar, and third molar. Now, third molars are commonly referred to as wisdom teeth. Because a human dentition is not generally large enough to accommodate them, the third molars frequently erupt on a slant or do not erupt at all, and that's a condition we call impacted. So impacted third molars cause swelling and discomfort and usually have to be surgically removed. So here we see the maxillary, the upper teeth, and the mandibular or lower teeth. The biting or chewing surfaces of your teeth are known as occluding surfaces. Now, when you close your teeth together, the maxillary teeth line up perfectly with the mandibular teeth, as you can see here, with the cusp of one tooth fitting nicely into the groove or fossa of its opposing tooth. This is called the occlusal plane here, and when your mouth is closed, we say that your teeth are in occlusion. Now, there are a total of 32 teeth in the adult dentition. Of course, most adults do not have that number of teeth due to the fact that, at the very least, most of us have had our third molars or wisdom teeth removed. Nevertheless, when numbering the teeth, you must always number them according to their positions in the full dentition. So here's your midline. Remember, direction is dependent upon the patient's perspective, so the patient's right is on your left. That makes this the upper right quadrant, or URQ, and here is your upper left quadrant, ULQ. Here are the lower left and lower right quadrants, or LLQ and LRQ respectively. And as you can see, there are 32 divided by 4, or 8 teeth in each quadrant. So here's the maxillary arcade. The maxillary teeth are numbered 1 through 16, and you begin counting at the upper right third molar, and you count clockwise. So tooth number 1 is your maxillary right third molar. Number 2 is the maxillary right second molar. Number 3, maxillary right first molar. Number 4 is the upper right second bicuspid, or premolar. 5 is the upper right first bicuspid. Then we have 6, the upper right cuspid, or canine. 7 is the upper right lateral incisor. And number 8 is the upper right central incisor. Remember, that's at the center of the arch on the midline. Moving to the left side of the maxillary arch, we have central incisor number 9, lateral incisor number 10, number 11 is your cuspid, 12 is the first bicuspid, 13 second bicuspid, 14 first molar, 15 second molar, 16 third molar. So if you drop down from there, you're on the mandibular arch, and your mandibular teeth are numbered 17 through 32. So we begin counting with the lower left third molar. And again, you count clockwise back to the right side. So third molar 17, 18 second molar, 19 first molar, second premolar is number 20, 21 is first premolar, 22 cuspid, 23 lateral incisor, and 24 left mandibular central incisor. Across the midline, we're into the lower right quadrant, number 25, mandibular right central incisor, lateral incisor 26, 27 is lower right cuspid, 28 first bicuspid, 29 second bicuspid, lower right first molar is 30, second molar 31, third molar 32. Let us now briefly examine the temporomandibular joint, or TMJ. Now, we will identify key structures of the TMJ, including the condyle and the articular cartilage, and we'll briefly discuss TMJ disorder. So as its name implies, the temporomandibular joint, or TMJ, is the ball and socket joint formed between the temporal bone, here, remember that's a cranial bone, and the mandible, here, and that's a facial bone. So let's take a closer look at the growth structures composing the TMJ. We know that the temporal bone here articulates with the mandible here. specifically the mandibular condyle or condyloid process, or simply condyle. Remember, that is the ball part of the joint, articulates with this indentation in the temporal bone. The indentation is known as the glenoid fossa or articular fossa, and that's the socket part of the joint. So this part of the temporal bone, known as the articular tubercle, keeps the condyle from slipping out of or dislocating from the glenoid fossa. Now, as with all bony joints throughout the body, there is a pad of tough connective tissue or cartilage between the fossa and the condyle. This articular cartilage keeps the bone separated so that you don't have bone grinding on bone, which of course would be very painful. Now, the whole of the joint is lined with connective tissue, thus forming a sealed pocket called the synovial capsule. Now, this hermetically sealed capsule is filled with synovial fluid. So what is the importance of synovial fluid, you ask? Well, I'll tell you. Synovial fluid is secreted by the synovial membrane. Remember, that's the soft tissue membrane lining the capsule. It has the consistency of egg whites, and it contains a substance called lubricin. Now, lubricin is a protein that, as you might guess, lubricates the structures of the joint. It's analogous to motor oil lubricating the parts of your car's engine so that everything works smoothly, efficiently, and in the case of your TMJ, painlessly. Now, you can actually feel your TMJs in action by palpating the sides of your face. Simply place your fingers on your face just in front of your ears, and then open and close your mouth or raise and lower your mandible. Temporomandibular joint dysfunction, or simply TMJ disorder, is a condition usually involving the muscles that move the jaw or the muscles of mastication. Now, features of TMJ disorder almost always include pain, restricted movement of the mandible, and noises like clicking or popping. Now, these symptoms often become chronic and extremely difficult to manage. Experts agree that TMJ disorder is caused by a combination of factors, so we call it TMJ syndrome for that reason. Those factors include physical factors like trauma and emotional factors like stress. However, there is no universal consensus as to the importance that individual factors play, or even as to the proper treatment of the disorder. Now, TMJ disorder affects between 20 and 30% of the population, and adults between ages 20 and 40 tend to be more affected than anyone else. Women seem to be more affected by TMJ disorder than do men, and TMJ disorder is second only to a toothache as the greatest cause of oral-facial discomfort. Okay, in the next lecture, we will locate and identify those structures in the head and neck that aid in the digestive process. So I will see you shortly.